Thanks again for joining us on Fertile Ground. Today, we're going to dedicate our episode to the subject of vaccine safety in pregnancy, as it can be a topic that patients often seek expert advice and reassurance on. As always, I'm joined by obstetrician and fertility specialist Dr. Jyoti, who has over 20 years of experience managing women's pregnancies and delivering healthy babies. Dr. Jyoti, welcome back.
Thank you.
Today I wanted to ask you a bunch of questions about vaccines during pregnancy, during fertility treatment, during planning for pregnancy. What
Perfect.
does that look like for our listeners?
So I think it depends how far out from a pregnancy you want to be if you're planning a pregnancy. So routinely, some ladies may go and have some antenatal screening tests done, particularly to see if they're immune to things like rubella or varicella or chickenpox, as we would normally call it. And those vaccines are important in pregnancy to be immune to those infections so your baby isn't affected by those potential infections in pregnancy. So with things like rubella and chickenpox vaccinations, those are live vaccinations, which means that we do not recommend pregnant ladies have those vaccinations. And we recommend that you're at least a few months out from getting pregnant if you have those vaccinations. It's not an absolute disaster if you are accidentally vaccinated with a live vaccine in early pregnancy, but certainly it's something that we try and avoid.
Yeah, that's a phrase that most of our listeners would have heard, was live vaccines.
Yes.
So in general, we try to avoid live vaccines when pregnant.
When pregnant, that's right.
I suppose when you're planning to become pregnant, you've got time to do whatever you
That's
like,
right.
and is a great time to do all that sort of thing.
Yes.
What about during fertility treatment? What comes into play then?
I think, again, fertility treatment is an area where you're planning a pregnancy, and most people going through fertility treatment would hopefully have already had all of that screening performed, already be counselled as to the dangers of live vaccination in early pregnancy. So again, hopefully they've had time to have those live vaccines a couple of months before actually becoming pregnant. You could theoretically have them during fertility treatment if you're not planning a pregnancy. So, for instance, if you're having eggs frozen, for instance, or if you're, again, sort of going through some of the preliminary investigations involved with fertility treatment, then it would be fine. And I think that you just have to speak to your GP or obstetrician about that.
You've got time, but let's keep an open dialogue about it.
Yeah, exactly.
But not all vaccines are live vaccines, right?
No, exactly. So there are a few vaccines we actually recommend during pregnancy.
Okay.
So one of them, of course, is the flu vaccine, and that is not a live vaccine. It usually is, a lot of women will ask me, well, how effective is the flu vaccine? Well, we try and predict which flus are going to be the most prominent during a flu season. And so we rely on the scientists to pick 3 or 4 of the most common flu viruses that they think are going to affect our population where we live at that time, usually during winter. And then that's put into a vaccine, and these are all non-live vaccines, so they're very safe in pregnancy, and we know that we recommend them to pregnant women, and they are free for all pregnant ladies. And the important thing about that is protecting the pregnant lady, but also some of those antibodies that are produced in the pregnant woman are actually transferred across the placenta and help to protect the newborn baby as well, especially during flu season.
I'm a big fan of the flu vaccine ever since I got the flu.
Totally.
Yeah.
I have mine
It's the
every
worst.
year. It's the worst.
It's the worst.
It's the worst.
So completely safe in pregnant women.
Completely safe in pregnancy.
Completely safe when going through.
Unfortunately, only about 80% effective, and that is because there may be other flu viruses around that aren't in the current flu vaccine. So unfortunately, some people will have the flu even if they have a flu vaccine. but it significantly reduces the severity of flu symptoms in pregnant women who are very susceptible to getting severe cases of the flu and actually ending up in intensive care or, unfortunately, on a ventilator because of the flu. So it can have some very serious implications.
Yeah, flu can be a really serious illness. Yeah.
Yes, absolutely, even outside of pregnancy.
A relatively new vaccine is RSV vaccine.
Yes.
Which is available for women for free, pregnant women for free.
Yes, it is, yes.
How important is it that women take advantage of that?
I think that our paediatricians would say extremely important. So, again, it's not just to protect the mother, but it's actually been designed to reduce the severity of RSV infection in babies and infants. So it is actually available to all pregnant women free from the government and recommended between 28 weeks of pregnancy and 36 weeks of pregnancy. If the baby is born within 2 weeks of the vaccination being given to the pregnant mother, then we actually are able to give the baby a free RSV vaccine. So in women who've had more than a few weeks to develop antibodies and give it to their baby, those babies won't require an RSV vaccine. But all other babies, if the mother hasn't received the vaccine in pregnancy or it's been less than 2 weeks since she's had the vaccine and the baby's born, then all newborns will actually receive the RSV vaccine. We believe it probably reduces the severity of illness in a vaccinated baby or the baby of a vaccinated mother by over 70%.
Yeah, wow.
So it's significant.
RSV is also a really
it's
an awful.
Awful. Yeah.
So anything you can do.
Absolutely.
Jump on it.
And I think, and my impression is that women are more than happy. They would have been more than happy to pay for the vaccine, but I'm happy to see that the government's paying for it.
I know I had to get this one when I was becoming a dad for the first time.
That's right.
The whooping cough vaccine is a really common one that not just for mum. Well, actually, tell me about that first. How does it work for pregnant women?
So for pregnant ladies, obviously, whooping cough is recommended in the 3rd trimester of pregnancy, anytime after 28 weeks. And it, again, is government funded, so it's free for all pregnant ladies in Australia. And it's, again, designed to help the baby gain some immunity from the mother, passively through the mother. So the mother produced the antibodies, they cross the placenta, and the baby receives those antibodies, and they help to protect the baby from whooping cough, which is a horrible, horrible infection for babies and makes parents feel very helpless when they look at their baby struggling to breathe. It's a horrible experience for parents. So the baby being immune to that for the first few weeks of life before it gets its own first vaccination is really important. So we do recommend it in every pregnancy. So a lot of women will say, well, I had it last pregnancy. Do I have to have it again this pregnancy? Unfortunately, yes, is the answer. But most women are very happy for their partners and for families seeing a newborn baby. It's important that they're also vaccinated. And usually our paediatricians will say a vaccination in the last 5 years is good. Government guidelines say around 10 years for their last vaccination. In Canberra, it tends to be once every 5 years. And it's a combined vaccination, so don't be worried if you're seeing that your vaccine contains tetanus and diphtheria. Those are safe to have in pregnancy. And in Australia, the vaccine comes combined. In other areas like the US, you may be able to get a separate whooping cough booster, but in Australia it comes as a combined vaccine.
And that encouragement for people around you to also get that vaccine, that's quite common in society now?
Absolutely, I think so, and I think it's very commonplace for friends of people having a baby to be asked to go and have the vaccine or to actually show the parents proof that they've been vaccinated. It's also a really awful virus to have as an adult. Yeah. So there's more than one reason, I think, to have the vaccine.
And vaccines now, you don't have to necessarily go to your GP to get them?
No. Some of these vaccines, you can just go to your local pharmacy and the pharmacist has a nurse usually on duty That's the way it works with flu vaccine, especially in Canberra. So you can just ring or go online, make an appointment, drop by. There may be some rules around pregnant women having vaccinations at the pharmacy, but certainly if you're certainly a friend or you're the partner of a pregnant woman, you can easily either see your GP or drop into the pharmacy and get your flu vaccine or your Boostrix vaccine, which is the whooping cough booster.
Thanks very much, Dr. Jyoti. There's heaps in there.
Great, thank you.